It is really tough enough being a teenager without having to do so during a pandemic. Teens are really struggling with depression and anxiety as they are coping with virtual learning, isolation, being cut off from their friends and their social life. And now as some school systems are preparing to head back to return to class, teens are facing a new challenge. And joining us this morning with more on that is Dr. Sarah Edwards from the University of Maryland Medical Center. Thanks for joining us this morning.
Hi, good morning. Thank you so much for having me.
You're so welcome. It is no secret that the mental health crisis for teens in this country is astronomical.
Definitely. We have seen increased rates of anxiety and depression all throughout the pandemic. It's really fueled by social isolation, as well as a disruption in routines. So it's wonderful as the schools are heading back, but returning to school will have lots of opportunities for regular structure and providing much needed in-person social interaction.
Well,
However,
yes and no. I'm sorry, I didn't mean to cut you off, but that's a yes and no. The kids are going to have to be separated. They're not always going to be able to sit with their friends. They're going to be wearing masks. And you can't just throw teenagers back into a setting and expect everything to be just exactly like it was a year ago.
that's exactly right, because it won't be. So of course, we imagine that we're going to have a lot of anxiety around the new situation. Kids are worried about going back, seeing friends that they haven't seen in a long time, and then a brand new environment that they'll have to adapt to as well.
So what's your advice for dealing with that? Because there are going to be a certain segment of teenagers that are going to say, I want to stay virtual. I don't want to go back in person.
Well, going back to school is a very individual family decision. So every family needs to discuss the risks and benefits and make that decision. However, when it is decided that they should go back to school, parents can do a lot of things to help. The main thing is to really validate and listen to the kids' concerns, to reassure them that we are here as adults, that we are helping to keep you safe, and we'll help you get through this. Kids are resilient, and we can make sure that everybody is able to tackle these difficult tasks and do it well.
And when it comes to getting help during this time period, during the pandemic, it's really not as easy as you might think. A lot of programs right now are virtual for kids in terms of finding maybe a therapist to talk to. And that's just another situation for them to be in front of a screen again.
That is true. So many of the mental health clinics in the area have really started doing so much telepsychiatry, but now with vaccination, clinics are open. Here at the University of Maryland, we've always remained open. We have appointments that we can see people in person and also accommodate and do telepsychiatry if that's what the family prefers as well.
You know, so often teens can sort of hibernate in their rooms, and it can be difficult for parents to tell if they're okay or not okay. What are some signs that they should be looking for?
It's a great question. So things that we're always worried about, especially with teenagers, would be if they start to isolate too much. So really not connecting at all with family or friends. We also worry about when they're more irritable, kind of getting into fights with family and friends. Anytime they're starting to talk about death or dying, that's a big concern as well. For younger kids, I know we've talked a little bit more about teenagers, but younger kids, especially with anxiety, we're looking for complaints of physical complaints like headaches and stomach aches. That's when you need to check in and ask questions and see how they're doing.
Look, we're going to have a whole segment of kids who are really behind in their social development because of this pandemic. And so what are you looking at in the future in terms of trying to help these kids sort of catch back up again?
Well, one of the things that's really important is to make sure that we realize that we are resilient. And so we need to always be very positive and frame that for our youth. So yes, of course, they have fallen behind. They haven't had as many social opportunities, but we know that providing them with that structure and routine will get everybody back on track.
Well,
so just to keep having open dialogue.
That's certainly a very hopeful way to look at things for sure. And then for parents who are seeking professional help, what is some guidance for you there?
For parents that are seeking help, again, we have mental health clinics who are around. That's super important because kids do well when parents do well. So we have to make sure that parents are putting on their own life jacket first and reaching out and getting resources and additional support.
All right, Dr. Sarah Edwards, thanks so much for joining us this morning. Really appreciate it.
Thank you so much. Have a great day.
You are welcome.